Hi, my name is Enzo. I'm the founder of Dental Tech Expert, and today we're going to try something maybe a little bit different, which is we created 6 different levels of maturity for a clinic to get into digital dentistry. But before we do it, as always, like, subscribe, do something about this video. The reason we did this, the reason we try to create these levels is that a lot of doctors that are getting into digital dentistry, they see 20 different kinds of equipment that they can buy. And some may think that you need it all to start with digital dentistry. And our idea here is to say that you can start as small with one item and grow from there. Level number 1 is the analog dentist, the one that is still doing the impression, sending out to the lab pours the model, and it does the traditional analog workflow. There's nothing wrong with it, but it's not into the digital workflow. What would be the profile or the kind of doctor that is on level 2, let's say? It is the doctor that has a scan, and it's basically using the scan to generate the STL files and send it out to the lab, and they are outsourcing pretty much every step of the process to the lab. So design, production, finishing, everything goes out to the lab. What would be the next step into this digital workflow for this doctor? I honestly don't think to go up another level, they need to buy another kind of equipment. I think they need just to use a little bit better the software behind the intraoral scanner. So what does a doctor on level 3 does? They're gonna scan and maybe do some smile designs, use that as a also commercial tool with their patients or to better communicate the treatment with their patients. And once they do a smile design, they can send that smile design to the lab, and the lab can use that as a reference to go on and finish all the case. Important thing to mention, at level 3, the doctor is not producing, is not doing anything in-house. Everything is being outsourced to a lab. What would be number 4? And I think most doctors that are getting into digital dentistry, they are almost, I'm gonna guess a number here, I'm just gonna say like 75-80% are starting here. It is the doctor that scans, does a simple design, and it is printing. SprintRay has done a great job with the Midas. Now we have the new shiny 3D printer, the ones that are really small, focused on single crowns. What a doctor can do once they have a 3D printer in-house, we're not only talking about just crowns, bridges, we're talking about bite splints, surgical guides. There are a bunch of other stuff that can be done once you have a 3D printer in-house, but that's usually what we call here number 4. So they've already scanned, they learned how to design, and now they're starting to do something in-house, maybe a long-term temporary with those ceramic loaded crowns, starts to do bite splints, start to do surgical guides if it's an implantologist. What would be from here the logical next step? It would be to get into the chairside dentistry. These are the CEREC doctors, the doctors that are doing Emax or lithium disilicate in-house. So they prep, scan, design, mill, finish all within an hour and a half, 2 hours, and they have this same day workflow. This has grown a lot in the past. I think now it has plateaued, but it is definitely the next step for someone that has a printer, is to have a chairside mill in-house. And number 6, it is also a growing segment, a growing level, which are the doctors that have in-house labs. And there are different levels to having an in-house lab, but here I'm focusing on, it is the doctor that already has some sort of chairside workflow and now is also working with zirconia on bigger cases in-house. So they probably have a 5-axis dry mill that is capable of doing both single crowns and full arches. They have a sintering oven, they have a porcelain oven, and usually a doctor that has this kind of workflow, they have a lab tech in-house to do all that. So this summarizes the 6 levels. So level 1, fully analog. Level 2, just a scan. Level 3, scan and design, maybe a little bit of smile planning. Number 4, scan, design, print. Number 5, scan, design, and mill on a chairside workflow. And number 6 can do everything plus zirconia on bigger cases. If you want to know where you stand within these levels, what should be your next investment, we're here to help. Feel free to reach out. We'll walk you through the different levels, costs, and anything to take you to the next level.